We all need to eat. Nutrition. It's literally the fuel that powers our bodies, helps us heal, and gives us the energy to just get through the day. It's one of the most basic, fundamental things about being human.
But what happens when that simple, essential act of eating just isn't an option? Maybe it's because of an illness, or a big surgery, or some kind of injury that makes swallowing difficult, or even dangerous. So how do you get the nutrition your body desperately needs to recover?
Well, this is where a really remarkable piece of medical tech comes into play. It's called a nasogastric tube. You'll probably hear it called an NG tube for short. And honestly, for countless patients, it's a genuine lifeline, making sure the body gets exactly what it needs to heal.
So let's get into it. What exactly is this device? Let's break down how it works as this direct route to getting better.
Okay, so its design is actually super simple, but really elegant. The NG tube is just a thin, flexible tube that's carefully passed through a person's nose, down the back of their throat, and straight into the stomach. You can think of it like your own personal food highway that just bypasses any traffic jams or roadblocks, delivering everything right where it needs to go.
And this thing is incredibly versatile. Its main job is usually getting food and medicine in, but it can also be used to drain stuff out of the stomach to relieve pressure, say after a surgery. It helps manage really bad swallowing problems, and in emergencies, it's even used for things like poisoning or clearing out intestinal blockages. It's a real multi-purpose tool for healing.
All right, so what do you actually need to place and use one of these tubes safely? Let's take a look at the tools of the trade. And while it might seem like a simple process, trust me, every single item here has a very specific job to do, and it's all about keeping the patient safe and comfortable. First up, obviously, is the NG tube itself. And they come in all different sizes, for everyone from tiny infants to adults. Then, for comfort, you've got a water-soluble lubricant to make insertion easier. And this next part is absolutely crucial for safety. A caregiver uses a syringe to push a tiny bit of air through the tube while they listen to the stomach with a stethoscope. If they hear a little whoosh sound, they know it's in the right spot. Perfect. Then, finally, just some simple medical tape to hold it gently and securely in place.
Okay, so we've got the tools. Now, how do they all come together for the actual feeding? Because it's not as simple as you might think. It's a really careful step-by-step process, all designed to be super safe and effective.
First things first, the patient sits up in a comfortable, upright position. This is a big deal. It helps with digestion and prevents something called reflux, where stomach contents can come back up. Next, the caregiver always double-checks that the tube is in the right place before every single feeding. Then, the liquid food, which has been warmed up to about body temp, is given nice and slowly. After that's done, they flush the tube with some warm water to keep it clean. And finally, and this is important, the patient stays sitting upright for at least another half hour just to let everything digest properly.
And this brings us to a really, really critical safety tip. The medical guides are super clear on this. You never mix medications directly into the food formula. Why? Well, it can cause weird interactions between the medicine and the nutrients. Or, even worse, it could create this thick gunk that clogs up the tube. So definitely a big no-no.
For a lot of people, an NG tube isn't just a short-term thing. It can be a longer-term part of life, and that comes with its own challenges, right? Psychologically, socially. So let's talk about what that's like and how modern innovations are making a real difference in people's quality of life.
And you can really see the evolution in care right here. The traditional tube, well, it leaves a long piece of tubing hanging outside the nose, and it needs replacing every single month. But check out the modern two-piece designs. They're way less noticeable, which can be a huge game changer for someone's confidence and just feeling normal in social situations. Plus, they last longer. They only need to be replaced every 3 months. That's a big improvement.
So, living with a tube also means there's some daily care involved. It's pretty straightforward, but it's super important. Things like keeping the nose and mouth clean, regularly checking that the tube isn't bent or kinked, and making sure the tape is secure but not bothering the skin. And here's another one of those absolutely critical safety rules. If the tube ever slips out, you never, ever try to push it back in yourself. That's a job for a doctor right away.
When you step back and look at it, it's such a simple thing, right? It's just a tube, but its impact is absolutely profound. For someone who can't eat, this little tube is a bridge back to health. It's a lifeline. It's really just an amazing testament to medical ingenuity.
This kind of technology really shows how far we've come in finding ways to support the body's most basic needs. But it also gets you thinking, doesn't it? What's the next frontier for nutritional support? As tech keeps advancing, what's it going to look like? Are we talking about even smarter tubes or something else entirely? It's a fascinating question.